Adenovirus cases spike in West Bengal. Know more about the symptoms, treatment, and precautions.
West Bengal is witnessing a spike in adenovirus cases, with pediatric wards in hospitals filling up quickly. At least 30% of samples sent to the National Institute of Cholera and Enteric Diseases (ICMR-NICED) in Kolkata since January have tested positive for the virus. An advisory has been issued to the health professionals to keep a watchful eye on symptoms that could be potential cases in order to identify and treat the disease in the state. Adenovirus refers to a group of viruses belonging to the family Adenoviridae. There are more than 50 different types of adenoviruses that can cause infections in humans, including the common cold, pneumonia, conjunctivitis, and gastroenteritis. Adenoviruses are highly contagious and can spread through contact with an infected person's saliva, mucus, or feces. Adenovirus infections are most commonly caused by types B, C, E, and F, and are typically spread when an infected person comes into close contact with another person. This can occur through the fecal-oral route, like touching contaminated surfaces and then touching the mouth, airborne transmission, like coughing or sneezing, or through small droplets containing the virus. Symptoms of an adenovirus infection can vary depending on the type of virus and the location of the infection. In respiratory infections, symptoms may include a runny nose, sore throat, cough, fever, and chest congestion. In eye infections, symptoms may include redness, itching, and discharge. In gastrointestinal infections, symptoms may include nausea, vomiting, diarrhea, and abdominal pain. Respiratory infections caused by adenovirus can lead to a range of complications, including acute bronchitis, bronchiolitis, and acute respiratory distress syndrome (ARDS). In addition, people with weak immune systems may be at risk for more severe complications such as myocarditis, inflammation of heart muscle, meningoencephalitis, inflammation of brain and spinal cord membranes, or hepatitis, inflammation of the liver. Adenovirus infections can be diagnosed through laboratory tests, including viral culture and PCR. Viral cultures involve collecting a sample of fluid or tissues from the infected area and growing the virus in a laboratory setting. PCR is a molecular technique that amplifies and detects viral genetic material in a sample. Prevention measures for adenovirus infections include practicing good hygiene, such as frequent hand washing with soap and water, wearing a face mask while in crowded areas, avoid unnecessary touching of mouth, nose, and eyes, avoid handshake with an infected person, sneezing and coughing into the elbow to avoid transferring the virus into the palms, avoid contact with an infected person. There is no specific proven antiviral medication for adenovirus infections. Treatment is usually symptomatic and depending on the clinical presentation. Some children would require hospitalization and some would require oxygen support. Treatment for adenovirus infections typically involves managing symptoms with over-the-counter medications such as pain relievers, decongestants, and cough suppressants. Rest is also important to help the body fight off the infection. In some cases, antiviral medications may be prescribed, although their effectiveness varies depending on the type of adenovirus. Stay safe and stay protected. Thanks for watching.